Welcome to the Saul's Newsstand News Review for March 22nd, 2019. The Washington Examiner reports, healthcare needs price competition, not just transparency. Is Washington finally about to remedy one of the key maladies plaguing American healthcare? Perhaps, but regulatory policies in Washington, D.C., Georgia, New York, New Jersey, and other states won't make it easy. The good news is that the Trump administration is moving this month to make providers disclose their prices, including the prices they charge insurers. The new initiative complements several related steps the administration has taken. The Centers for Medicare and Medicaid Studies, for example, recently launched a website, Procedure Price Lookup, enabling Medicare patients to compare total out-of-pocket costs for procedures commonly performed at hospital outpatient facilities and ambulatory surgical centers. The agency's hope is that by providing information about the costs of various medical procedures, patients will be empowered to shop more prudently, discouraging some facilities from overcharging. The White House also is hoping to use price transparency to reduce medical costs in other areas. The administration's American Patients First proposal would require drug providers selling products that cost patients more than $35 a month to reveal their prices in television advertisements. An article from the Heritage Foundation states, how Medicare for All bills would worsen the doctor shortage. Medicare for All may sound good to some Americans until they take a closer look at how it actually would work. Take something pretty basic, how it would affect the number of medical professionals we have in this country. Medicare for All would drive out many doctors and nurses and compromise the accessibility and quality of medical care for millions of Americans. The reason? Medicare for All bills mandate major payment reductions for America's healthcare workforce. Vermont Senator Bernie Sanders' bill, for example, would use today's Medicare payment system for reimbursing doctors, hospitals, and other medical professionals. Medicare rates are fixed by law and regulation, not some private market-style negotiation. Those rates are set significantly below private sector rates and often do not cover the true cost of providing medical services. Doctors and hospitals routinely depend on private health insurance to close the gap. The Senate and House Medicare for All bills, however, would outlaw private health insurance and thus eliminate the freedom of medical professionals to negotiate payments outside of the government monopoly. We would encourage you to read the full article by clicking on the link in the description below. And finally, Chairman of the 60 Plus Association Jim Martin writes, the Medicare Trust Fund is projected to run out of money, but Congress can still act. It comes out of every American worker's paycheck. It is the tax for Medicare. It covers hospital care, nursing homes, and surgery for the nation's elderly. But experts say the money is dwindling as more is coming out than going in, and Congress will need to act. They paid into the system all their lives. They don't want to hear that it's going bankrupt, said 60 Plus founder Jim Martin. Martin is one of the over 59 million people enrolled in Medicare, according to the Centers for Medicare and Medicaid Services. He founded 60 Plus over 2 decades ago to give the elderly another voice in the nation's capital. Now at 83 years old, he still works to educate his fellow seniors on the status of their health care. The Medicare Hospital Insurance Trust Fund is projected to run out of money by 2026, according to a Congressional Budget Office report published in January. The trust fund helps cover costs for things like inpatient hospital stays, nursing homes, and hospice, according to the CMS. Regarding the situation, Martin said, there has to be work on both sides of the aisle to fix it. Let's stop the demagoguery. Seniors deserve better, quite frankly. And that concludes your Saul's Newsstand News Review for March 22nd, 2019. For more political news faster, visit saulsnews.com.